Thanks for everyone who stayed till the last session on a Friday afternoon. And that's a very informative presentation on nutrition. I'm going to talk about exercise as a treatment enhancer in lung cancer patients. So according to American Lung Association, exercise can improve fatigue, anxiety, depression, cardiovascular fitness, muscle strength, gastrointestinal side effects, and breathing. First, let's look into some evidence from literature. A 2022 review of 10 randomized control trials found preoperative exercise reduced complication by 55% and the hospital length of stay by 2.2 days. And the most compelling recent trial, the 2025 Czech multicenter RCT in high-risk patients, showed a 14-day prehab program cut complication from 55 to 34% and reduced stay from 9 to 7 days. This slide highlights the evidence for post-operative exercise. With the 2020 review of 3 trials investigated the effects of exercise after lung resection. One study of a 20-week program improved physical and mental quality of life and reduced dyspnea. Another study of a 10-week program reduced body pain significantly, but not global quality of life. Overall, exercise after surgery is safe and improves symptoms and quality of life, though effects vary by program design and duration. So what does a typical exercise intervention look like? This slide here summarizes a dose range of aerobic and resistance training to help different aspects of patient health. In general, aerobic training 2 to 3 times per week with 30 to 60 minutes per session, plus 2 weekly resistance training at moderate to vigorous intensity are recommended. Other than aerobic and resistance training, breathing and stretching are also recommended to strengthen the diaphragm, improve postures, and support oxygen and blood flow. So in terms of intervention delivery, programs may be clinic-based or home-based with the help of telehealth and wearables. So what does the guideline recommend? According to the ASCO 2022 article, oncology providers should recommend regular aerobic and resistance exercise during lung cancer treatment and pre-surgery. And a 2024 review advises 150 minutes per week of moderate intensity aerobic activity plus 2 resistance sessions per week. However, gap still remains. Many patients lack awareness of exercise benefits and access to exercise programs. And many surgeons reported uncertainty about referral pathways despite their willingness to delay surgery for prehab program. In addition, most evidence we just presented came from structured trials, which don't always reflect what happened in everyday life. But real-world activity is just as important, and our work aims to bridge that gap. So to capture the real-world activity, we used Godin Leisure Time Exercise Questionnaire. This simple validated self-report to ask patients how often in a typical week they do strenuous, moderate, and light exercise for more than 15 minutes. Each type of activity is then weighted by intensity to create a total score. Then patients are classified as active, moderately active, or sedentary based on their total score. We administered this questionnaire to I-ELCAP patients at Mount Sinai before surgery and at 1 month, 6 months, and 1 year time points after surgery. This diagram here shows the patient flow chart from around 1,500 patients with completed exercise form at Mount Sinai. We narrowed down to 585 patients with stage 1A lung cancer, less than 3 centimeters, and with no additional treatment within 1 year after surgery, and with pre-surgery and follow-up forms. So totally, we have 1,400 exercise form across baseline and follow-ups. Here is the comparison of baseline characteristics between the patients who were active and sedentary at baseline. Overall, we had 315 patients split fairly between two groups. Active patients were less likely to smoke, had lower BMI, and fewer comorbidities, showing a healthier baseline profile. Here are the preliminary survival results looking at the disease-free survival by pre-surgery activity level. The Kaplan-Meier curve included 315 patients who had the pre-surgery exercise form. The red line represents those who were classified as active, and the blue line represents those who are classified as sedentary. And as we can see that the two curves are very close together, and the log-rank test did not show a significant difference. However, it did show a trend that active patients had a slightly better survival compared to sedentary patients. What's more interesting is when we look at how change at activity patterns from pre-surgery to follow-up related to survival. Here, patients are categorized into 4 groups: those who stayed sedentary, became sedentary, became active, or stayed active compared to baseline at follow-up. Although there is no statistical significance, we can see patients who stayed sedentary from baseline to 12 months, as represented by the orange curve, had worse survival than the other groups. So in conclusion, exercise is safe, effective, and still underutilized in the care of lung cancer patients. Survival trends are complex but encouraging. We did see consistent trends that suggesting that patients who stayed active had better survival. And at the same time, real-world activity is messy and complex. Patients face barriers and often need structured guidance or even exercise prescriptions to capture the benefits. So looking ahead, we need to have more patients with completed exercise data collected to assess survival differences. In addition, future work should also leverage wearables for objective measures, reducing the reliance on self-report. Finally, implementation is critical to make exercise a standard part of perioperative care. We will need systems for reimbursement, clear referral pathways, and clinician education.